Hello, I'm Sylvia. I'm a level 3 certified yoga teacher, a medicine woman, someone who has developed a holistic body integration system for hypermobile neurodivergent people. And I'm also a TMJ doctor certified face trainer. Today I'm going to talk about splints, hypermobility, and do splints actually and mobility aids actually work for a hypermobile body? And if they do, why, how, and when, for how long? I myself have been through a journey of discovery. I understood while going through traditional TMJ disorder treatment what was missing from the treatment. I also understood by working with neurodivergent, neurocomplex people who had jaw and facial pain, why traditional treatments and approaches out there didn't work for them. And I also helped these individuals, my ex-clients, to break pain cycles that traditional treatments, medical doctors, and other specialists were unable to help them with. Hypermobility can affect any area of your body. Yes, your jaw too. When it comes to the jaw, how traditionally the jaw joint is being treated is that the good qualifying doctor, not all doctors are qualified as a side note, is going to create you a splint. So the splint is aiming to support the jaw joint to help it recover, to give it time, and also to move your bite into the right position. If you're fortunate enough to live somewhere where a qualifying TMJ disorder specialist doctor is available, and if you have the funding to pay for the treatments, there is one type of splint that is actually really good for the jaw. It's really good for the recovery of the jaw joint and to actually help the condyle to be, the disc to be recaptured, and it helps the healthy operation of the jaw. And the one type of splint that is actually really good, and this is the kind of splint I also had, a form and variation of it, is a anterior repositioning splint. Let's hear from my TMJ doctor who treated me with TMJ disorder, Dr. Mariam Bakhtiari. See what she says about anterior repositioning splints. Hi, Dr. Mariam.
Hi.
I wanted to ask you about a very specific splint that you mentioned before in one of our videos. And I do want to inform my followers and my customers. This is specifically about the anterior repositioning splint. Can you show me how it looks like? Yes. And maybe say a few words about it, what it is.
Well, there's several different kinds of anterior repositioning splint. It's basically, anterior means that the splint is going to move your lower jaw forward, anteriorly, forwardly. It's not a splint that pushes you back. It pushes you forward.
Yes.
And then this creates space in the back teeth so you can't clench and grind at night.
Yeah.
Let me see if I have one here to show you, which yes, I do. So, for example, this is an anterior repositioning splint. It looks like a full appliance, but it has a little ramp here. And when the lower jaw comes in here, it moves the lower jaw forward, and the ramp doesn't let your jaw to fall back. It guides you from falling where it's not supposed to go. So it goes on the top, and you move your lower jaw forward to come here. So we're displacing the jaw forward.
So yes, some splints are good, some splints are bad. I have read really horror stories about splints because I was so actively in this field, super focused on research, super focused on actually beyond research, because there is not much studies that were conducted on this topic. So my research was based on living with real life people suffering in pain and failed by the medical system. And according to that, and according to what I also heard from other TMJ doctors, is that it is true that some splints can actually retract the jaw. A good splint deprograms the jaw from its bad habits, but that's not enough. If your daily habits continue to include clenching, for example, in the jaw, and your nervous system is also sensitized, you are in a chronically dysregulated state, and that happens for neurocomplex people, neurodivergent people with complex PTSD. If you're hypermobile, the situation gets even more complicated, and why you need to absolutely make sure that you are investing your money at the right place and you are very careful and cautious what type of splint you put in your mouth to treat your jaw, to eliminate and reduce your jaw pain or clenching and grinding that you experience in the night. So for you, definitely I recommend to not gamble with your health, because we hypermobile people, highly sensitive people, neurodivergent, neurocomplex people, we respond to things real fast in a way that, what I mean is that our connective tissue is designed for rapid response, and this could be a good thing or a very, very bad thing. If you are given a splint that is one of those splints that is actually retracting your jaw, because there's a lot of laxity in the tissue, there's a lot of hypermobility, and the connective tissue is giving the signals to the brain, and the pain signals can also amplify. Because of that, you may get into a really undesirable situation with your jaw, where your bite is really moving off into the direction we don't want your bite to move to, which is, for example, could be an open bite or could be an overbite when the jaw is retracting. So yeah, there's rapid tissue response. This could be also used to your benefit. On the other hand, when you take the right instructions, the right physiotherapy, the right training that is specifically tailored to and designed for hypermobile neurodivergent people. Not all of my clients were hypermobile or neurodivergent, but all of them experienced some form of trauma. And having trauma in your body also can classify you as a neurodivergent person, just as a side note. So what we need to also consider is your nervous system, how your body responds to instructions, what is the type of training and education that you need. A lot of exercises that I have seen on YouTube is absolutely horrific, scary for people with hypermobility around the jaw, hypermobility around the cervical spine. So a lot of things can backfire if you don't do the right thing. I don't say this to mean to scare you. I say this to give you a awareness. Proprioceptive training, helping your body, your brain to locate your jaw, not just in a resting position throughout your day. For example, if you are a jaw clencher, you have to develop a daily awareness of what is going on in your jaw, and then daily intentional pattern interruption of that jaw clenching by gently parting the upper and lower teeth away from each other. This is one thing you can start doing right away, and it's good for people hypermobile or not hypermobile, because this is the other thing with hypermobility. Doesn't mean you're all flexy everywhere. Yes, there could be a lot of range, too big of a range for the jaw, but there could be also not enough range or too much tension, a lot of compensation that's happening in the body when it comes to hypermobility. If you're not addressing these root causes, then the splint is not going to be as effective. Now, also, splints do not train your muscles. I said what I said. I do not believe that splints train, or it's not enough training for muscles like the lateral pterygoid, the medial pterygoid muscles, the digastrics, the suprahyoids. I'm including pictures of all of these here for you guys to see what muscle groups I'm talking about, because all of these need to be trained. Now, here comes a thing. You would think, well, wouldn't the physiotherapists be targeting these muscles? Theoretically, yes, but their training is very outdated. These are all my opinions, what I have seen firsthand experiencing TMJ disorder, muscle dysfunction, and nervous system dysfunction, having to go through dysautonomia and actually regaining my life and my sanity through the work I have developed and also teach or taught to others for 3 years, the last 3 years. The other thing, yeah, so there needs to be exercises, but it needs to be updated exercises, and that's what I created and developed while going through TMJ disorder recovery myself and helping others. So a big problem I have seen with clients that they were victims of is wearing splints for too long. Wearing these neuromuscular splints, or whatever you want to call them, that were given to them by neuromuscular dentists for too long. Also, some splints, questionable splints, dislocate the jaw joints. Some splints even cause the jaw to retract and causing more issues in the jaw joint. I've seen this firsthand. Again, people who came to me for jaw joint support were also people who were failed by an army of doctors before they came to me. And and the work was never just about the jaw joint. At that point, you're already so shaken and disappointed by systems, and maybe even your own body, that the work also needs to include this soul level mending, soul level recovery. So we have to include that in your recovery plan. So as I mentioned, a lot of my clients, I didn't work with too many people. I think throughout the 14, throughout the last 3 years, I worked about with 14 people, and that's the database I have to work with, including myself. These clients of mine, some of them wore splints for too long, and the work was also to deprogram what the splint was programming. And speaking of programming, the proper training around these muscles that I mentioned also program your jaw, and it creates this healthy blood flow, healthy circulation. And the question is, are splints actually useful? Yes, they are, but they are useful when you use the right ones, given to you and custom made by the right doctor, and you also add in the holistic training that is actually going to train your jaw towards function.